Well, first of all, thanks for carving out some time during your day for what we think is a pretty important conversation. My name is Bill Rubin, for those that I've not had an opportunity to meet. We've got about 50 or so people on the session today, and we're going to be respectful of everybody's time. I'm going to provide some just very brief introductions, maybe talk a little bit about the format, and then turn it over to our two presenters. So with the introductions, I'd like to introduce Laurie Diaby, who is the St. Croix County Public Health. She's with the St. Croix County Public Health Department, where she's a public health supervisor. And then Kelli Engen, who is also with Public Health, where she serves as the public health officer. And the roles of both Laurie and Kelli have become increasingly important over the last 100 days or so. Very important. And we're delighted that they were able to provide some time to be part of this program. It's intended to be a conversation. They're going to share some slides with us. I think we're informal enough where if a question does come up, I think it can be asked at that time, but we're going to reserve some time at the very end for questions and so on. So with that, I'm going to turn it over to Laurie and Kelli.
Great, thank you. Thank you all, yes, for taking the time to meet with us today. It's during a pandemic, it's hard to find out to always manage the amazing amounts of different stakeholders that are all involved in a pandemic. And I will first say that I don't know if I need to be, I'm just so thankful that Bill was able to pull this together and have this opportunity so we could have a conversation and you guys can better understand kind of what our role in public health was. Bill said something kind of interesting there in his intro related to Laurie, and my job has become increasingly important in the last 100 days. I would argue and say our job is always very important. But you just don't really hear about us or see about us, see what we do, because we are always working behind the scenes. We do communicable disease investigation daily. You just really get to hear a lot about it during the pandemic. So what we will do today is talk briefly about a timeline so you guys kind of have an understanding on how long that public health and that we've been dealing with COVID, as well as how it's kind of morphed and changed. We'll talk about the interventions that we currently have right now. I'm sure there are a ton of questions. There is a ton of media, and it's all you see in the news, right? COVID. So you're hearing lots of different kinds of information related to treatments and potential treatments and what you can do to reduce the spread. And really right now there is, there are some treatments that are being studied. This is new for everybody. It's very interesting to me as we look and read things related to COVID and watch the news. And we really are, even our experts are saying we just don't know. And it's a really strange time to have to deal with the public's health, frankly. We'll also talk a little bit about what we do specifically. We'll share a little bit of data so you have a better idea about what is actually currently going on in St. Croix County. We've tried to show some of that data through our data dashboard, which I hope you are all aware of, that can be found on the St. Croix County website. And then Laurie will really talk with you guys about numbers 3 and 4 there. So you can ask questions and we can walk you through what happens when we do get somebody test positive in a business. And that has happened, in fact, more than one time, quite a few times, as we get back to work and reopen things. And obviously, the more people who are around each other, increases the risk of transmission. So we fully expect to continue to get more cases, and how we manage them, we ask for your help too. So let's advance the slide. Oh, that's right. It's the animated. Okay. So, what's interesting is when this first came out in January, it was started in Wuhan, China. And in January, we actually first saw, I was contacted by our state Department of Health, and they said, you have a traveler in your jurisdiction who just got back from Wuhan, China. So right away in January, we were we were alerted, like, oh, okay, what does this mean? We started learning about all the precautions and the role of public health and what that would look like if that traveler would have turned positive. So right away from the beginning, we really started prepping and ramping up what does this look like. Then we had a lull. We didn't have any cases. The person who had traveled did not test positive. And then March, the second week of March, right around spring break for various districts, that's really kind of when we started to see an increase in cases. I'm not going to read you these slides. You can kind of see where things progressed through the case through March. In St. Croix County, our first case, I believe, was actually right before the first case in Wisconsin. Laurie, and you can help me too. I believe our first case came on March, like right in that same week, March 18th.
Yep.
But I think it was before.
Yep, I should have put that on here, but yeah, I think it was.
That's okay.
Right around.
No
Yep.
worries. No worries. So you can kind of see what happened in March. Obviously, there was a lot of interventions done since we know we don't have treatment or a vaccine currently. We do what are called non-pharmaceutical interventions, and part of the non-pharmaceutical intervention was really staying home, and that's under that safer at home order. That's really was our best defense against COVID, since we didn't know a ton about it. Since there is still very limited treatment, I mentioned that just a brief minute ago. These are the things that you're seeing likely everywhere, and you maybe even have signs posted yourselves. Right now, this still continues to be some of the safest things we can do to reduce transmission and protect our most vulnerable populations. Next slide, please. So I do want to talk a little bit about, I know this unfortunately really has been an issue that has become very political. And I want to just highlight a couple things related to the local health department's role and what statutory authority that we have always had. I think there's some misconception out there that now, because of this pandemic, local health departments or state health departments are trying to gain control. We always had that control within the state statutes. And as I kind of alluded to a little earlier, when you don't hear about public health, when you don't see what we do during the non-pandemic times, people don't really realize how much authority, not that we want the authority, I don't mean to make it sound like that, but what those local statutes said even prior to COVID. And they are, you can look them up, they're Wisconsin State Statute 252. And that really governs communicable diseases and what local health departments are supposed to do in the control and spread of communicable diseases. So just want to point that out, and right now might be a really good time to also point out that even though we have no order here in St. Croix County, we currently don't have an ordinance nor an order, but that doesn't mean we can't still get court orders for individuals that are not complying with our recommendations related to isolation and quarantine. I think that's really important that people understand that, which is totally separate from safer at home. There are concepts that are the same, but when we're talking about individuals, that's different than kind of the safer at home order. And there might be questions about that later. We'll do our best to answer. We don't have somebody from legal on today, so we'll get you the best we can, and then if we can't answer, we can always get back to you. So not going to read those. Do we know, can everyone see the sign, or do we have people, or I mean the slides, or do we have people who have called in today? Okay, well, how about I just quickly say what communicable disease is all about is investigating, preventing, suppressing, and controlling communicable disease. This may require isolation of sick and quarantine contacts of people who have tested positive for COVID. And this really stands, like I talked about those statutes before, this really isn't just specific to COVID. This is any high transmittable communicable disease such as tuberculosis, measles, some of those higher contagious and disease that spread very quickly. And the statute also talks about doing what's reasonably necessary to control an outbreak or an epidemic, which may include closing schools or putting restrictions on public gatherings. Next slide, please. I don't think everybody was on when I said we've had 17 cases in the last 2 days, not counting 4 cases related to an industry outbreak in the county. So 17 plus 4, I guess that's 21 cases in the last 2 days. 146 are our total cases standing. Now that goes back from March until now. The total recovered are 107. So that means you have to do a little simple math. So the active cases then are right around that 39 mark. I probably did that math wrong. So that's how many active cases. And when we say active, those people are likely still under an isolation, not order, because we try to keep everything as least restrictive as possible with individuals and businesses for that matter. And we always seek to get voluntary compliance with anybody we are having communication with and giving recommendations to. Our testing of individuals in the beginning was really slow. There was lots of information, or lots of barriers, I guess, to testing a ton of people right from the get-go. And it wasn't just one single thing. There were many different barriers to testing. I do want to just say quickly about this slide. We are really still continuing to work on better reporting hospitalized St. Croix County residents, as well as St. Croix County residents who may be hospitalized out of county, as well as non-St. Croix County residents who may be hospitalized in county. We do have one of our hospitals that is serving as kind of a COVID overflow unit. So they are hospitalizing, taking overflow that may not be St. Croix County residents within their 4 walls. I encourage you guys to go and check out our dashboard. We tried to throw this, well, we didn't try to throw it together. We tried to be strategic and throw this together about things people want to know, lots of questions we're asking. We did just recently hire a PIO for St. Croix County. His name is Adam, and I think he's on today, and he's really been helping us gauge better what kinds of questions we are getting from the various stakeholders, so we can pay attention to that and really craft what we display to you all to really answer a variety of those questions. Just quickly, when you do go out to our dashboard, can you see my little screen mover or my little pointers move around here? These are 4 different, so in the bottom right-hand corner, yeah, there you go. Thank you. Thanks for doing that. You can switch, you can toggle between, there's different maps. We can't toggle that for you because this link isn't live right now, but you can check out cases, number of cases that came in per day, which might be what we're on. And then you can look at the recovered cases per day, as well as you can look at both of them in the same graph. It's kind of a messy graph. And then there is also, the last tab is a link or a map that shows the statewide data, and they actually break down into census tract data, so you can check that out and click on certain census tracts and find out how many cases are actually positive within that census tract. Not active, but ever tested positive. Next slide, please. Okay, actually, you know what, Laurie? Why don't you do a little overview of this? This is something fairly new related to DHS data. We've been waiting and waiting for DHS to put out this data. I don't know a whole lot about it other than this site just went live within the last couple of days. So I will be quiet and let Laurie discuss this one.
Okay, so I just wanted to pull this up because this was, as Kelly just said, it was just released in the last, I think, less than 48 hours ago. The state put this out, and this is a way that people can monitor what's happening across the state. I did a screen snip to show St. Croix County, and how the state is presenting this data is based on 2 factors, on burden and trajectory. And so the burden is your case rate. It's the number of cases per 100,000. And then they balance that with the trajectory, where they're comparing the last 2 weeks data compared to each other to predict if cases are increasing or the activity level of the cases. And then they establish a definition, if you will. So if you look down in the highlighted area, it says that for burden, St. Croix County is considered moderate, and for the trend, that trend line where it shows that little dash mark, that means the trend is saying that for the last 2 weeks, it's sort of maintained, it's about the same. And then the activity level they categorize as medium. So, and then there's a link here that you can go to the DHS website and you can learn all about this. I'm hoping that those that attend this course, there's a way that we can get this slide deck to you so you can use these links live, and you can go in there and play around. It's just another place where you can get more data.
And just to add to that, we will be using this data as we start to make different recommendations. Obviously, with no order, what we are using are guidance and recommendations. Sorry, here's my video. Guidance and recommendations, and we will be looking at this data. I don't want to do that independently with just the health department making those decisions. It is important for you guys to know we are on calls weekly with infection prevention providers, all within Pierce and St. Croix counties, as well as long-term care facilities, as well as our school administrators. So that is happening on a weekly basis, and those kinds of decisions obviously public health will make the recommendations, but we don't want to do that independently of the rest of the community. So I just wanted to add that. Are we ready to go to the next slide, Laurie?
Sure. And I'll just say, like this doesn't include, like Kelly was saying, that we've had a lot of activity the last couple of days. So, this slide here is showing without what's happened this week. Okay.
Yeah, thank you for saying that, because that's very important. I likely anticipate that arrow will be increasing next week. Laurie, do you want to talk about the data?
Sure.
All right.
So this first upper left-hand corner is just the number of tests per week. Like Kelly was saying early on, we weren't getting a lot of tests done, and you can see how our testing level has increased. And then the bottom left-hand corner is the number of positives that have happened each week. So, that shows that's where, like these two right here, 14, 15, where that last slide, it said we were about the same. That's looking at those weeks right here, where there's 14 and 15. And then also you probably have seen in the news where they talk about, they try to break down who or what COVID is, what populations are most affected by COVID. And so nationally, you hear a lot about how it's the piece of people that are hospitalized are in immune compromised, or they're in an elderly, category, people over 60 or over 55. And this is our data here in St. Croix County showing the number of cases where our highest number of testing positive are in this, 20s range. Which, depending on our audience here today, this could be, a big part of your employees. I'm not sure. I don't know exactly who's all here today, but, and then down here nationally.
Oh, hold on. I'm sorry. I don't mean to interrupt you. I really want to point out the fact that because of we are the highest impacted age group that we have right now in St. Croix County is the 20 somethings. I just want you guys to be aware, La Crosse County, and maybe you guys are aware, but La Crosse County is experiencing 20 cases per day. They had a light day on Monday with only 15 cases, but it's become a huge problem in the 20-something-year-olds. So just as a reminder, if the 20-something-year-olds you are employing and you have a business that potentially works with elderly or people in vulnerable populations, good reminders and education about what they do outside of work does matter. So if you need help with messaging or educational materials, please reach out to us and we will do the best we can to get you talking points or whatever you need to really try to reinforce that with that age group. Mm-hmm. Sorry, Laurie.
No, that's great. And then by gender, nationally, they also indicate that for whatever reasons, it seems to be affecting males more than females. And that is also reflective in our St. Croix County data. And we'll go to the next slide. And there's some links in here so that you can study this a little deeper and get this all into perspective. But nationally as well, COVID seems to be affecting non-white populations at a higher rate than the proportion they are in their communities. That's hard to explain that. But so in St. Croix County, which is on the right-hand side, it's a little hard for me to see my screen because my little thing is in the way. In St. Croix County, when we do interviews with positive cases, there's 2 questions that we ask regarding race or ethnicity. And these are the categories that people can volunteer information about themselves. Not everyone is willing to answer that question. And so for race, 83% of the person's positives responded to that question, and 71 of that 83 were white, and then the rest were in those other categories. And for ethnicity, 80% of the people were willing to answer the question, and 56% of those said that they were non-Hispanic, and 23% said they were Hispanic or Latino. And when you compare that to what our population is in St. Croix County, which is about between 2.5% and 3% non-whites, it demonstrates that St. Croix County is also like the national data, where it is impacting non-white populations as well at a higher rate than. It's a little bit hard to explain that. Kelly, did it make sense?
Yep, it makes sense. COVID is disproportionately impacting our minority populations.
Oh, okay.
Thank you. Thank you.
Yeah, hold on. Mute my.
All right. So next slide. All right. So now we're going to go into a little bit about what happens if there's a positive case. When someone goes to their healthcare provider, first of all, public health does not do testing for COVID at this point. We're not doing any testing in our office. So someone is going to be tested at their healthcare provider, or there's a number of places that people can go to get tested. They have drive-up clinics, I think, in Stillwater. And by the way, we do have on our COVID page on the website, we have a list of places where people can go get tested. But public health, because we're required by state statutes to investigate communicable disease, we receive the lab results sometimes before the person's or even the clinic gets it, or we at least get it at the same time as the clinic would get it. And it's our responsibility then within 24 hours to start an investigation, a disease investigation. So we receive them in a system, an electronic system that's called WEDS. That's way deeper in the weeds than you probably need to know. But when we have someone that reviews those, and some days we get 200-300 of those a day, and we review, go through those, and then the nurses are assigned to the cases, to the positive cases. And then they start notifying people. They notify the positive case that they need to be isolated, and they explain to them what that means. And then we interview them and determine who their close contacts are. And a close contact is someone that either lives with them or has been within 6 feet of them for more than 15 minutes. And we determine if they are someone that has been working. We find out if they were working at the time that they were considered infectious. And then we also work with the employers to determine if there were any close contacts while that person was at work when they were infectious. Someone that is isolated, and that's a person that is a positive case, they need to be at home for a minimum of 10 days. And they also have to be symptom-free for 3 days. So an employer needs to know that for a person that tested positive, we don't know for sure when they are going to be able to come back to work. It depends on, it's going to be at least 10 days, but they also have to be symptom-free for 3 days. So that's a question mark. You don't know for sure when they can come back.
And I'm just going to interrupt you quickly, Laurie. Our schools especially are asking, well, we need to know when we can let people back in, or say if it's in an industry or a business, we need to know when people can go back on the floor or back to work. And it really, truly, it's so hard to just give blanket templates related to that, because it really is dependent of when their exposures were, who they exposed, how, when they got sick, and if they were even symptomatic or not. I will say we have been seeing asymptomatic people test positive, and they likely got a test because maybe they were a known exposure to a positive case. So it is really important to be diligent in understanding and being patient with us in understanding. We can't give you blanket statements about how long people have to be out from work.
Mhm. And then the household members or the persons that are considered close contacts, they will remain in quarantine at home for 14 days to monitor for symptoms. The science shows that persons that are exposed to COVID-19, it may take up to 14 days before they become symptomatic. So that's why it's that 14 days. Most people are developing symptoms between that 5 and 8 day, but not everybody. So
That's right. And just know that for those people who are testing asymptomatically, who are testing positive without symptoms, I think there's still a lot of unknown about when is that prime time to do a test and when should we be testing. But we do know that there people who are testing positive aren't always symptomatic. So that's important to keep in mind.
Mm-hmm. And, I think the big key message with this, understanding this process for business owners, is that I think everyone understands and expects that someone that's test positive is going to be removed from their schedule until they're well. But what needs to also be factored in is for every person that tests positive, they usually have between, it depends how mobile the persons are, but sometimes we have had cases where people have 20 or 30 close contacts. Average, I would say, is around 4 to 6 close contacts is what we're finding, but that's changing as people feel more comfortable to move around in the community. The number of close contacts is growing. So it's a huge impact on a business if they have employees that are determined to be close contacts to that positive person. And that's where it's important to really reinforce within your business. People need to stay 6 feet away from each other while they're working, if at all possible. This doesn't mean that people can't walk by each other in the course of their work, but they need to have separate workstations and kind of be working separately. Because if you're able to do that, it will help you remain open if you have positive cases, because those people aren't going to be determined close contacts and have to be removed from the schedule.
And just one other thing, it might be a good time to think about face coverings. We know face coverings have reduced transmission. We're a lot less likely to spread COVID if a person who is sick has a mask on, and then if a person who isn't sick also has a mask on. The early studies have shown that transmission is greatly reduced when both sick individuals and non-sick individuals are wearing masks. Not that we're saying you have to mandate it, but it might be a good reinforcer to say, yeah, we could get behind this, especially for those of us who have businesses where they're facing the public and you don't know who may be coming into your businesses. Also, one very important thing that you need to know, if you do have a positive case within your business and they test positive, and then you do decide to do testing for all of your employees, and if the positive employee has contact with maybe 5 other people in close, we identify them as close contacts. By getting those 5 close contacts tested, and if they test negative, that does not mean they get to come back to work. What that means is they have tested positive at that point in time. They still need to remain within the 14-day quarantine, because as Laurie said, what we know right now is if people after an exposure to COVID, they're likely going to get it within 14 days. So if they get a test on day 6, or if they get a test after the exposure with the positive case, we need to still go out the full 14 days, even if they have a negative test. So that is kind of hard to grasp too, and I probably didn't articulate that super well. So if there are questions, we can take them after.
And, you know, when this happens to a business where you have a positive case, and I wish that I could say it's going to go away tomorrow, but it's not. So if you haven't had it happen yet in your business, it's likely that it probably will. And there's a misconception by some, public health does not want to close businesses. So when you have a positive case in your business, we are going to be working with you to make sure that there are environmental safety controls within your business to prevent further spread. We're going to have the close contacts at home until their 14 days are up. The positive people are also isolated, and we want you to continue to remain open. There is some environmental cleaning that we want businesses to do once they have a positive case. Sometimes businesses will close on their own because they don't have enough staff to stay open. Because once they have determined all the close contacts and the positive, they don't have enough people to keep their business going. And in some of those cases, businesses have reduced their hours, or if it's a restaurant, maybe they make their menu simpler so that they can stay open. But unless there's a large outbreak and the business is not working with us, I mean, we have never done it yet, but that would be the only extreme situation where we would really encourage a business to close if they're not working with us and don't want to put controls in place.
And just quickly too, if you are aware of somebody who has tested positive that works for you, it is a good idea to check in with public health. This week we have seen public postings about businesses that have closed, and it is a good idea to just call or email Laurie or I and say, hey, we do have a positive case. So we are making sure that we understand, not that we're going to do anything with this information other than help you do exactly what Laurie just said about going through all those proper things. But I will say we have had some less than honest, I guess I'll say, people who have been either identified as a close contact when we talk to, and they aren't always either they maybe don't do it intentionally or they are doing it intentionally, not telling us absolutely everything, which just doesn't help us reduce risk and decrease spread. So if you are an owner and you know of somebody, it is important for us to just heads up email, or you can call, and I'm sure all our contact information will be given out to you guys, so you have that.
I don't know if I know we're going to have some questions at the end, but just if you have a question, you could jump in on this, or we can wait till the end, but otherwise I'll move to the next slide. Kelly. So our recommendations for safe operation, we have a health advisory on our website, and there's a link to it, which has about 12 or 13 different sets of guidelines based on specific business types. It addresses organizations, faith communities, businesses, schools, and also public gatherings. But in general, key points are anyone that's sick should stay home. Staff, volunteers, and the public should maintain 6-foot distance from one another unless they're members of the same household. So this kind of affects businesses on two levels, both your employees as well as your customers. That's where, like in restaurants, we talk about having tables 6 feet apart, etc. Wearing cloth masks, which Kelly talked about a little bit already. Health screening of staff and volunteers. And when we talk about health screening, it's not just taking temperatures. It's asking them about other symptoms, because as we're understanding COVID, we know that people have a range of symptoms, and it doesn't always include a temperature. We want you to plan and train. So you have a plan. If you do have a positive or multiple positives, what will you do? Everyone should be washing their hands often, clean commonly touched surfaces often, and providing information around your business about COVID and posting reminders is good. Those are just some of the key things that I pulled out of the health advisory that kind of apply to all businesses. But like I said, there is specific guidelines in our advisory. And we always, Kelly, well, I'll let Kelly talk about this one.
Sure. And actually, Laurie, let's finish with this slide. I'm kind of watching the time here, so I want to make sure we have enough time for questions. So this can be our last slide that we show, which there isn't. I think there's just a quote on the other slide, so you're not missing any great information. These are the reputable sources we encourage people to go out and get their information from. CDC, DHS, and then most everything on our St. Croix County site is either local data or links that point you to either the CDC or DHS. So I think we will go ahead and open up for questions.
I have one since nobody else is talking. On the second slide, it showed that back in January, it seemed that we had COVID in this area, yet we didn't have a positive case until March. Is that just simply because there was no testing available until March?
No, I wouldn't say that we didn't know if we had COVID in the area. What I'm saying, sorry if I didn't really articulate this clearly, in January, we had somebody travel back to St. Croix County that had been in Wuhan, China. Not that that person had COVID. That person was tested and tested negative. What I was trying to get at is we early on got a little taste of the role public health would have to play if that person would have tested positive. So yeah, sorry about that.
That's okay.
Yep.
And is there any insight into when antibody testing will be available in our area to see for people who think they may have had it and want to find out?
Yep. So antibody testing is available now, and what we are saying, we are cautiously advising of antibody testing. I even think not all of our medical providers are doing antibody testing, because right now we don't know if just by having been exposed and having antibodies, we don't know yet if that means you're immune to COVID. There's potential you may be able to get the virus and be symptomatic again. So I would encourage everybody to contact their local providers if they are interested in antibody testing. So that's right now with the antibody, that's all we really can say.
Okay, thanks.
Yep.
This is Judy Ochterhoff. Can you hear me?
Yep.
Okay. Curious as to what level does St. Croix County have to get before we have to, I hate to say this, but take it a bit more seriously?
Yeah, that's a really great question, Judy, and a very important one. Be- I think until gosh, it's really a tough one to answer because I want to be so careful in how I answer this. But we know right now there's really two different groups of people who, are dealing with COVID and learning about COVID, and some we do talk to people who don't even believe COVID is happening. And that is definitely concerning to me. And we do the best we can to educate people. Yes, COVID is happening. I think one of the reasons why people maybe aren't taking this so seriously is if you go back and look at our data, and those 20-something-year-olds are our biggest or our largest group that have COVID, and they aren't getting too sick, right? We've done a really good job, if you remember that data slide. So the 50, 60, and 70-year-olds, we don't have a ton of high numbers of COVID within our most elderly or most vulnerable populations, which is great, and that's fantastic. But I wouldn't be doing my job as a health officer if I still wasn't concerned about all those 20-year-olds who likely might get it. It might not be a terrible, huge burden to them. They might be well within 3 days. But my worry is who else are they exposing while infectious? So I did not answer your question because it's a tough question. And I think one people should be asking themselves.
So Kelly or
Someone-
Laurie, if a business wanted to be proactive and say start health screening, are there vendors out there? That's not a role for public health or a nurse or anything. How does a company wish to implement, again, just on the proactive side, just some sort of health screening?
Well, so there's a variety of tools out there because it's not anything elaborate, Bill. That's a really good question. People can just start with a screener, like before the employee even comes into work. Have your employees be diligent and answer questions that give a sense of potential exposures, or if they potentially are feeling sick or may be coming down with COVID. And we could get those resources together and get out to everybody if you haven't already seen them. I know there are fancier ways to screen people, whether they're infrared temperature, thermometers, or body scanners. Those are pretty resource intensive, I might say, but we could definitely do that. Laurie, do you have anything to add on that?
No, just that we could get, we here at St. Croix County, we have a sign at all of our entrances that talk about the different, do you have a temperature? Do you have a cough? All that kind of stuff, health screening questions. I know some businesses have shared with me that they have their employees fill something out each day. They come into work and they're not actually physically taking their temperature, but they're asking their employees to do that. So there's all sorts of different levels of how you could incorporate a health screening and that consciousness to your employees every day that they come to work. Or public, public, we don't screen, you at a restaurant, I don't have anybody that's saying they're screening their, the customers that come. It's primarily your employees.
Sharon posted a question on the chat. Her question is, thoughts on protocol now on folks that are flying and when they return back home?
That's a really great question. And we've been getting more questions related to travel as we are opening back up and things get moving. I haven't looked into this a ton because some of our questions are related to people calling us and asking, hey, I'm going to such and such a state and they're requiring requiring me to have a negative test before I enter their state. So I will look into that, unless Laurie, I'm sorry, I shouldn't discount you. Maybe you have some ideas about this. Otherwise, we can put this together in a follow-up email.
Yeah. I just know, listening to the news, that now there's some hot spots in states around the United States that, potentially would be concerning if you had someone travel from those areas. But yeah, we can put that information together. And there's on our health alert that's on the COVID webpage. One of the links that's in there is on travel, and it links back to CDC and has the most current recommendations for travel that are regularly updated. So that would be a good place to go for that information.
Thank you.
I have a question as far as if somebody were to test positive in a business that does work with the public, say a restaurant or a bar. I know other counties in the state are publishing that information as far as customers need to be tested if they were there from this state to this state. Does the St. Croix County intend to do that as well?
That's a really good question. And so right from the beginning, I've been saying, if we can identify close contacts and we have a good idea about potential risk and exposure of COVID within the facility, I don't really think it is necessary to share that information. For one, I think it has all kinds of probably likely unintended maybe not even unintended consequences related to businesses. However, with that being said, I just heard a presentation from the La Crosse County Health Officer who really has quite a robust and very transparent process as to how they do public notifications and the why behind it. So I guess at this point, I would say if we are able to identify risk with close contacts, we likely wouldn't start doing that. But I guess I just don't want to say absolutely not, because I think we want to watch what's happening in other areas and see how that's working with them. Jen Rombalski from La Crosse County did share, that she can't believe how well that's going. Obviously, I'm sure businesses who are on her list and on her website are not thrilled or happy. But it is when you aren't able to identify public who may have been in contact with a bartender per se, or a server potentially, more likely a bartender situation. Public notifications sometimes that is the only way to get a hold of them. Otherwise, short of wanting to have people sign in, which I know we don't want to go that way. We don't want people to sign in at your businesses when they sit down and are having a meal or a drink. So I guess the answer right now is we haven't had to do it. And we'll kind of play out, see how it works for other counties. But we would definitely give you guys a heads up and have you involved in that process before we would do anything that you didn't have some at least knowledge of.
I do have a clarification question on something that was said earlier. If I was listening correctly, I believe you said that even if an individual who had direct exposure to a positive and they choose to get tested should still be self-quarantined for 14 days beyond date of exposure. Did I hear that correctly?
Yep, you sure did. You did hear that correctly.
Okay, thank you.
Yep, no problem.
Judy Outdroff again. I got two things. One is a statement that because you've been talking to other counties and hearing different things, I just want to let you know that I'm hoping that St. Croix County will support you with anything you need or to do. I mean, we may not be doing it now. I know economically we definitely are not, but I just want to say that. And my other thing, it goes back to my original question. No, you didn't answer it. Do you have plans about what you will do if it does go sky high? I'm not asking what they are, but I mean, the way you answered it, you didn't answer it. So if there starts being 50 cases one day, 70 the next, 100 the next in St. Croix County, I'm assuming you must have some kind of a plan and some kind of a situation where, okay, this has to start now.
Yep, and we will take every case. You know, we will continue to work on all the positive cases. When it gets to be big, too big to handle, which some might think, I bet our team thinks we're probably there already. I cannot do that on my own as the health officer. This is something that would need support by a lot of different boards and committees. And right now we just aren't there yet.
Interest in maybe distributing the slides from your presentation or maybe using a central location? How would interested participants on the session today, how would they go about getting them? And we can sure distribute them, but we don't want to overload an inbox either with distributing slides.
Could put it on the COVID webpage, on our COVID webpage.
Perfect.
There'll likely be ideas of how we should do that, I'm guessing, from even maybe our internal county people. So once we get that direction, we could let you know, Bill, and you could send that out, or Nita, or whoever is helping organize.
Other questions?
Selena.
I have a question as far as if we were to need to switch from county-led guidelines into more of mandated county-wide issues. Who makes those calls if it's not the health department?
Bill.
That's a really, really good question. Dave Osnes, do you want to take this one?
It's a collaboration, Dave.
I can see you smiling, Kelly. Thank you.
You're welcome.
It's a collaboration.
I think it's a collaboration with a lot of different agencies that are working very, very well together. And you guys do a super job with that.
Hey. Yep.
So there's not a real direct answer there. You know, we're tax-paying citizens here that would like some information. Can you give us a little bit more of an answer than that?
So what would need to be in place is an order. St. Croix County would have to have an order in place to enforce any kind of restrictions. And because of all the confusion and different things, and not even confusion, but with the safer at home order being struck down or voted against, I think counties are really left in an interesting position. We have chosen not to go with an order. We are really relying on all community stakeholders to do what is in the best interest of themselves, our most vulnerable, the elderly, and that is where we are at. There would need to be likely a potential ordinance, apparently, that the local health department could act under, specific or maybe not so specific to communicable diseases. But I think it is a really, I'm not trying to avoid your question at all. I'm trying to be very careful at what is said and what the information is given. I don't know if there's anyone from the county who wants to weigh in on that.
Kelly, this is Bob. Hello, everybody. I'm Bob Rarrett. I'm the new HHS director replacing Fred Johnson. So I've been on the job all of 2 weeks, but I'll give my quick answer to that. I believe that for an ordinance to be passed, it would be a requirement that the board, the county board, approve such an ordinance. And that would be in response to public health needs that were identified by Kelli or the health officer and the community. But that's my 2 weeks into the job answer at this point.
It's geriatric. I would agree. And I personally feel that an ordinance should be passed ASAP. That doesn't mean you're going to put it into effect or do anything about it. But it does mean that if something does need to be done, you can go ahead and do it. Right now, you would have to wait for the board to meet, make the decision, pass it, and then continue. And in a situation like this, speed to me is pretty important.
Thank you, Judy. I really can't even tell you how much I appreciate that.
Any other questions? I think we're just about at the end of our 60-minute time. And so with that, I'll thank Kelli and Laurie, and I'll thank everybody that took the time to get on the session. And I will look forward to some follow-up. And again, this is a very, very important matter. And I think you can tell by the number of attendees and the depth of the questions that people are very concerned about it. So with that, I will thank you for everybody getting on the call, and we'll look forward to maybe touching base again.